Hello everyone. Today we are going to discuss neoplasia. What is neoplasia? Let's see. Neoplasia literally means new growth, and a new growth formed is known as a neoplasm. The word has come from Greek. Neo means new and plasma means thing formed. The term tumor was originally used for the swelling caused by inflammation, but it is now used synonymously with neoplasm. So related to neoplasm, another word is oncology, which means the study of tumors or neoplasm. And also this word has come from Greek onkos, which means tumor. In the present era, a neoplasm can be defined as a disorder of cell growth which is triggered by a series of acquired mutations involving a single cell and its clonal progeny. Let's see what are the features of neoplasia. First, origin. Neoplasms arise from cells that normally maintain a proliferative capacity. Genetic disorder. Cancer is due to permanent genetic changes in the cell known as mutations. These mutations may occur in genes which regulate cell growth, apoptosis, or DNA repair. Heritable. The genetic alterations are passed down to the daughter tumor cells. Monoclonal. All the neoplastic cells within an individual tumor originate from a single cell or clone of cells that has undergone genetic changes. Thus, tumors are said to be monoclonal. Carcinogenic stimulus. The stimulus responsible for the uncontrolled cell proliferation may not be identified or is not known. Autonomy. In neoplasia, there is excessive and unregulated proliferation of cells that do not obey the normal regulatory control. The cell proliferation is independent of physiologic growth stimuli, but tumors are dependent on the host for their nutrition and blood supply. Irreversible. Neoplasm is irreversible and persists even after the inciting stimulus is withdrawn or gone. Differentiation. It refers to the extent to which the tumor cells resemble the cell of origin. A tumor may show varying degrees of differentiation, ranging from relatively mature structures that mimic normal tissues, which is called well differentiated, to cells so primitive that the cell of origin cannot be identified, which is known as poorly differentiated. Next, come to the 6 P's of neoplasm. P stands for purposeless, progressive, proliferation unregulated, preys on host, persist even after withdrawal of stimulus, which already we have got, like autonomy, permanent genetic changes in the cell. Now, the classification of neoplasm. Tumors are classified as benign and malignant depending on the biological behavior of a tumor. So what are the benign tumors? They have relatively innocent microscopic and gross characteristics, remain localized without invasion or metastasis, well differentiated, their cells closely resemble their tissue of origin. The prognosis is very good, can be cured by surgical removal in most of the patients, and the patient generally survives. What is malignant tumors? Cancer is the general term used for malignant tumors. The term cancer is derived from the Latin word for crab because similar to a crab. Malignant tumors adhere to any part of that they seize on, is in an obstinate manner. Invasion. Malignant tumors invade or infiltrate into the adjacent tissues or structures. Metastasis. Cancer spread to distant sites, metastasize, where the malignant cells reside, grow, and again invade. The prognosis is very poor. Most malignant tumors cause death. Benign tumors, in short, we can say, resemble the tissue of origin, well differentiated, slow growing, capsulated or well circumscribed, localized to the site of origin. Some of the benign tumors, for example, adenoma, it is the benign epithelial tumor arising from glands or forming glandular structures. Papilloma, the tumors, these are also benign tumor with visible finger-like projections. Polyp, tumor produces visible projections above mucosal surface and protrudes into the lumen. Polyp may be sometime benign or sometime it may form malignant tumor. So, in case of malignant tumor, they are termed as carcinoma or sarcoma depending on the parenchymal cell of origin. The features are, we have already discussed, well differentiated to poorly differentiated, grow faster, poorly circumscribed, invade the surrounding tissues, metastasize to distant sites. So carcinoma means the tumors derived from squamous, transitional or glandular epithelium, like adenocarcinoma. Tumors of the hematopoietic system are indicated by the suffix emia, for example leukemia, malignant proliferation of leukocytes. But let's see the differences between carcinoma and sarcoma. Carcinoma are always malignant tumor of epithelial origin, and sarcomas are they derive from mesenchymal origin. Carcinoma came from the Greek word carcinos, which means crab, and oma, which means growth, mostly from inside lining of a colon, breast, and lung or prostate. Sarcoma came from the Greek word sarx, means flesh, and oma, which means growth. They arise from musculoskeletal systems such as bones, muscles, and connective tissue. Carcinoma is more common cancer, more than 90% of cancers. Sarcoma is less common, that is less than 1%. Carcinoma can occur most commonly in middle and old age group, but sarcoma can occur at any age. The rate of growth for carcinoma usually not very rapid, but sarcoma the growth is very rapid. Route of spread. Carcinoma initially lymphatics and later hematogenous, but in case of sarcoma they spread by usually hematogenous and lymphatic spread is rare. Sites of metastasis. The sites of metastasis for carcinoma through blood, liver, lung, brain, bone, and adrenal glands, and sarcoma may spread to lungs. Gross appearance. Carcinoma usually looks like cauliflower. In squamous cell carcinoma, carcinomas infiltrate all nearby structures, nerves, veins, and muscles. Sarcoma, they grow like a ball, fleshy masses, and tend to push nearby structures such as arteries, nerves, and veins away. For example, carcinoma breast, squamous cell carcinoma of skin and mucous membranes, carcinoma stomach and colon, and sarcoma example osteosarcoma, chondrosarcoma, liposarcoma. Next, see nomenclature of few benign and malignant mesenchymal tumors. So here we can divide like cell of origin, benign and malignant. Fibrous tissue, if the tumor has derived from fibrous tissue, then if it is benign, it's called fibroma, and in case of malignant, they are called fibrosarcoma. Then fat cell, lipoma, malignant liposarcoma. Blood vessel, benign form is called hemangioma and malignant form is called angiosarcoma. In case of cartilage, they are called chondroma if benign and chondrosarcoma if malignant. If they are originated from bone, then in case of benign, they are called osteoma and osteogenic sarcoma if malignant. Smooth muscle, leiomyoma, leiomyosarcoma. Skeletal muscle, rhabdomyoma, and in case of malignant, rhabdomyosarcoma. Means these are malignant and benign form of tumor which is derived from mesenchymal structures, means sarcoma. Nomenclature of carcinomas, it's like if they are originated from ectoderm, means epidermis, then they are called squamous cell carcinoma. If derived from mesoderm, for example renal tubules, then they are called adenocarcinoma. If derived from endoderm, means the lining of the gastrointestinal tract, then they are called adenocarcinoma. What are the factors? What are the risk factors, environmental factors which may lead to cancer? So all of us know that some of the factors which influences the growth of cancer cells, such as smoking. Cigarette smoking is an important factor involved in cancer of the lungs, mouth, pharynx, larynx, esophagus, pancreas and bladder. Alcohol abuse. Alcohol abuse is a risk factor for carcinomas of the oropharynx, excluding lip, larynx, esophagus, and can produce alcoholic cirrhosis, which is a risk factor for hepato-cellular carcinoma. Alcohol and tobacco together increases the risk of cancers in the upper airway and digestive tract. Infectious agents. For example, human papilloma virus spreads through sexual contact and is etiological factor for carcinoma of cervix as well as some head and neck cancers. Obesity, it is associated with cancer risk. Hormones, exposure to estrogen stimulation if unopposed by progesterone increases the risk of cancers of the breast and endometrium. Carcinogens, they may be present in food, for example grilled meat, high fat diet, alcohol, water, for example arsenic, environment like ultraviolet rays, asbestos, drugs, medications, for example methotrexate, etc. Characteristics of benign and malignant neoplasms. It is very important to differentiate benign and malignant tumors mainly because of the different prognostic outcome. In general, benign and malignant tumors can be distinguished on the basis of four fundamental features, namely differentiation and anaplasia, rate of growth, local invasion, and metastasis. What is differentiation? It is defined as the extent to which neoplastic parenchymal cells resemble the corresponding normal parenchymal cells. This includes both morphological and functional differentiation. Differentiation determines the grade of the tumor. Benign tumors, they are well differentiated. The neoplastic cell closely resembles the normal cell of origin. It may be not possible to recognize it as a tumor, but microscopic examination of individual cells, that is lipoma, Only the growth of these cells into discrete lobules discloses the neoplastic nature of the lesion. Mitosis, they are rare and of normal configuration. So here is an example. In the figure, the lipoma is a benign, well-differentiated tumor composed of lobules of fat cells that are identical in appearance to normal fat cells. We can see in the figure. Malignant neoplasms show a wide range of differentiation of parenchymal cells, varies from well-differentiated to completely undifferentiated. Cancers are usually graded either as well moderately or poorly differentiated, or numerically often by strict criteria as grade 1, grade 2 or grade 3. Well-differentiated tumors. Well-differentiated adenocarcinomas of colon may form normal appearing glands. Squamous cell carcinomas may show cells which appear similar to normal squamous epithelial cells. Poorly differentiated tumors. They consist of cells that have little resemblance to the cell of origin. Moderately differentiated, these tumors show differentiation in between the well and poorly differentiated tumors. In the figure, we can see well-differentiated adenocarcinoma of the colon. It shows cancerous glands that are irregular in shape and size, invading the muscular layer of the colon. But in this stage or in this grade, it is well-differentiated, means they are similar to the normal cells. But in this figure, we can see poorly differentiated carcinoma consisting of tumor cells showing variation in size of cells and nuclei. One tumor cell in the center show an abnormal tripolar spindle. Next, what is anaplasia? Malignant neoplasms composed of undifferentiated cells are called as anaplastic tumors. Lack of differentiation, both structural and functional, is called as anaplasia and is characteristic of malignancy. The degree of anaplasia in a cancer cell correlates with the aggressiveness of the tumor. Thus, more anaplastic the tumor, the more aggressive it becomes. Microscopic features of anaplasia. First of all, pleomorphism. It is defined as variation in the size and shape of cells and cell nuclei. It is a feature of malignancy. Thus, cells within the same malignant tumor range from large cells, many times larger than the neighbor cells, to extremely small, primitive appearing cells. Nuclear shape and size. Nuclear shape and size is variable and may be irregular. Extremely hyperchromatic nuclei of tumor cells are due to abundant chromatin and increased amount of DNA per cell compared to that of a normal cell. Loss of polarity. Orientation of cells to one another is known as polarity. The anaplastic cells lose the normal polarity. Markedly disturbed orientation, architecture of tumor cells. Growth pattern. Malignant neoplasms usually show unorganized growth. Rate of growth. Benign tumors are well differentiated and usually grow slowly. Most malignant tumors grow more rapidly. Next is local invasion. Local invasion. Benign tumors, they are localized. Most benign tumors grow as expansile masses that remain localized to their site of origin. No infiltration into adjacent tissue or capsule if present. No metastasis. Capsule. It is a rim of compressed connective tissue derived mainly from the extracellular matrix of the surrounding normal tissue. Capsule makes tumor palpable and movable mass, can be surgically enucleated. Benign tumors without capsule, unencapsulated, examples hemangiomas, uterine leiomyoma. So here is a figure, diagrammatic representation of a capsule in a benign tumor. We can see in benign tumor they are always capsulated or circumscribed. Malignant tumors, lack of capsule. Malignant tumors are poorly demarcated from the surrounding normal tissue and lack true capsule. Invasion. Two most reliable features that differentiate malignant from benign tumors are local invasion and metastasis. Local invasion, invasion of adjacent tissue or origin. The cancers may invade and destroy the adjacent tissues or organ. Invasion of blood vessels and lymphatics. Diagrammatic representation of cut section of an invasive ductal carcinoma of the breast. Dysplasia. The cells that show cytological features of malignancy, and the term dysplasia is used for these changes. It literally means disordered growth. The changes of dysplasia include cellular pleomorphism, large hyperchromatic nuclei, high nuclear to cytoplasmic ratio, loss of polarity or architectural orientation. We have already discussed what is pleomorphism, how they become hyperchromatic nuclei, loss of polarity. Another feature is metastasis. Metastases are tumor deposits discontinuous with the primary tumor and located in a distant tissue. This process is known as metastasis, and the resulting secondary deposits are called metastases. Significance. Metastases clearly identify a tumor as malignant because benign neoplasms never metastasize. Metastases strongly reduce the possibility of cure of cancer. Metastatic spread is the most common cause of cancer death. Here we can see in the figure metastasis of the multiple secondary tumor deposits in the lung parenchyma, and in another figure malignant squamous cells deposits in the liver. Pathways of spread. Pathways of metastasis, usually lymphatics, hematogenous, spread along body cavities and rarely along epithelial lining. Lymphatic spread, most common pathway of spread for carcinoma. Regional node involvement. The walls of lymphatics in the region of cancer are readily invaded by cancer cells and form a continuous growth within the lymphatic channels. For example, cancer stomach, carcinoma prostate, breast cancer. Hematogenous spread. Cancer cells easily invade capillaries and venules, but thick-walled arterioles and arteries are relatively resistant. Renal cell carcinoma. Hepato-cellular carcinoma. Target organ for metastasis, liver and lungs. Bone metastasis. Cancer metastasizing to bone, prostate, lung, breast, liver, intestine, kidney and thyroid. Vertebral column is the common site of exposure. For example, carcinomas of the thyroid and prostate. Other common sites are brain, most common primary site in lung cancer, kidney and adrenals. Organs relatively resistant to metastasis, for example, skeletal muscle and spleen. Spread along the epithelial lined space. It is not common. For example, carcinoma endometrium may spread to ovary or vice versa through fallopian tube. Carcinoma of kidney may spread to lower urinary tract via ureters. 4 types of genes involved in neoplasia: oncogenes, tumor suppressor genes, DNA repair genes, genes involved in apoptosis. Let's see differences between benign and malignant tumors. So we can divide like microscopic features, gross appearance or gross features, and clinical features. So microscopic features like differentiation or anaplasia. In case of benign, well differentiated. In case of malignant, well to poorly differentiated. Anaplasia is characteristic. Pleomorphism in benign usually not seen, but in malignant commonly present. Nuclear morphology: benign usually normal, malignant usually hyperchromatic, irregular outline and pleomorphic. Mitotic activity: in benign rare, and if present they are normal bipolar. In case of malignant, high and may be abnormal or atypical, tripolar, quadripolar or multipolar. Polarity: in benign it's maintained, in malignant usually lost. Chromosomal abnormality: in benign not found, in malignant usually seen. According to gross features: border or capsule, benign mostly circumscribed or encapsulated, malignant usually poorly defined. Areas of necrosis and hemorrhage: in benign it's rare, malignant common, often found microscopically. Clinical features: according to clinical features, rate of growth: benign usually slow, malignant relatively rapid. Local invasion: benign usually well demarcated without invasion or infiltration of the surrounding normal tissues, malignant locally invasive, infiltrate surrounding normal tissue. Metastasis: benign absent, malignant frequent. Biological behavior or prognosis: benign usually prognosis is good, malignant prognosis is poor, usually death due to local invasion or metastatic complications. Carcinoma in situ. Some carcinomas evolve from a pre-invasive stage called as carcinoma in situ. What is the definition of carcinoma in situ? It is a pre-invasive epithelial neoplasm, shows all the cytological features of malignancy, involves the entire thickness of the epithelium, remains confined with the epithelial basement membrane. The tumor cells cannot reach the potential routes of metastasis such as blood vessels and lymphatics until the basement membrane has been invaded. Here we can see the example for carcinoma in situ in the figure. We have discussed what is neoplasm, what are the features, are always confined to different types of neoplasms, basement membrane of the epithelial lining. So thank you everyone for your patience listening. Thank you so much.